everyone, so in this video I will be talking about fetal circulation. So what is fetal circulation? Fetal circulation is basically a blood circulation that happens inside the fetus. So there are lots of differences between the fetal circulation and also the adult circulation. In fetal circulation, the lungs do not function. The right and the left lung do not function. They are compressed. Why? Because the lungs are filled with amniotic fluid. If you see here the fetus, right? The fetus is surrounded by the amniotic fluid. So it is very impossible for this fetus to breathe in oxygen, okay, for gaseous exchange. So gaseous exchange does not happen in the fetal lungs. That is first point. Second point is, in fetal circulation, along the way later, you will see that there are shunts. What are shunts? Shunts are a hole or a passage where blood deviate from the normal circulation and bypass organs. So in fetal circulation, they bypass the liver and also bypass the lungs, because no point of traveling into this organ, right? Because fetus, they need oxygen as soon as possible so that they can perfuse, they can transport the blood, the oxygenated blood or blood with oxygen and nutrients to whole body so that they can develop properly. All right, so now let's move on to this little drawing first. Right, so this drawing, amniotic sac filled with amniotic fluid, and then you have fetus there connected to the placenta via this umbilical cord. So this placenta, the mother's blood drain into this placenta, right? The labeled as red there. And this finger-like blue, labeled with blue, that is actually the chorionic villi, where the fetal blood try to absorb oxygen and also nutrients from the maternal's blood, right? So again, the maternal's blood are not 100% oxygenated. It's actually a mixed blood, oxygenated and deoxygenated blood. So imagine blood from the mother's. Okay, in the heart, of course, it's 100% oxygenated because it's fresh from the lungs, the mother's lungs. Then it pumps out to the aorta. On the way to the placenta, for sure the blood have already given off some oxygen to the organs that can be found above the placenta, right? So because the mother needs oxygen and nutrients too, right? Then when it reaches the placenta, the oxygen level might drop. But that is okay because the fetus, they have fetal hemoglobin, right? Their hemoglobin is called fetal hemoglobin. As adult, we have adult hemoglobin. So what is the difference? Fetal hemoglobin, they have the ability to absorb as much oxygen as they can, okay? And they absorb oxygen at faster rate compared to the adult hemoglobin. So even if the oxygen concentration is low in placenta, they are still able, or this hemoglobin F are still able to capture or to absorb and transfer or transport to all parts of the body, right? So that is the beautiful function of fetal hemoglobin. But in adult hemoglobin, if you have fetal hemoglobin, too much of fetal hemoglobin, it could be a sign of blood disorder like thalassemia and sickle cell disease, right? So in adult, we only have little of fetal hemoglobin, right? But it is normal for fetus to have it in a high percentage, right? So now let's go to this diagram, which can be seen in a medical textbook or from the internet journal article. Usually they have this kind of diagram, right? Just a schematic diagram. So we start here from the placenta. Like I said, oxygen and nutrients got transferred in the placenta. So this oxygenated blood will be carried by umbilical vein into the heart. So vein here does not transport deoxygenated blood only. It can transport oxygenated blood. As long as the vessel brings blood back to the heart, that is called vein. While arteries are the vessels that carries blood away from the heart. Right? So that is the true definition of veins and artery. So going back here, so oxygenated blood will be carried by umbilical vein into the heart, but At one point, this umbilical vein started to divide into two pathways. One pathway going to the liver and another pathway going to this duct. What is this duct? This duct is actually a shunt, a passage, a new passage where blood can bypass an organ. In this case, it bypassed the liver. So what is this shunt called? So in fetal circulation, it is very important to have a shunt. So the first one, it is called ductus venosus. Right? So it's ductus venosus because it connects umbilical vein and the inferior vena cava. Both are veins. So this duct connects these two veins. So oxygenated blood, most of oxygenated blood will follow this route, alright, the ductus venosus, and drain the oxygenated blood into the inferior vena cava. Why not here? Alright, in the liver, this is actually liver sinusoids filled with small capillaries. And that takes time for blood to reach the heart. Alright, so we don't like traffic jam. Alright, if I drive also, I will try to avoid the jam, okay, the heavy traffic jam. So I will follow a clear road, right? For sure you will do the same thing. Same like the blood, they want to use the route, okay, the route where it can drain the oxygenated blood into the heart at a faster rate, alright? But here, some blood which makes their way into this liver, will also eventually drain into the right atrium, right? But it takes time, right? Because it's slower there. And again, inferior vena cava also drains the oxygenated blood from the lower limbs of the fetus. Again, not only inferior vena cava drains blood into the right atrium, but also another vessel called superior vena cava, which drains deoxygenated blood from the upper parts of the body, like your head, your brain, right? So that will go into the right atrium also. So you see there are mixture of blood there. We have oxygenated blood from placenta, deoxygenated blood from the superior vena cava, and some from the inferior vena cava. So what happened? You have mixture of blood. Alright, so you have mixture of blood. Since loss of blood is actually going to the right atrium, to the right atrium, so it means the pressure inside the right atrium is high. Okay, actually in fetus or in fetal heart, the pressure in the right atrium is higher compared to the left atrium. In adult, it's the opposite, like left atrium has higher pressure compared to the right atrium. So what happened? What causes right atrium to be in higher pressure compared to left atrium? Everything has a reason, okay? Everything has a reason. Why? Because blood in the right atrium will not go to the lungs. Like I mentioned earlier, lungs are not functioning. It will not go to the right ventricle, to the pulmonary artery, and then into the lungs. No, that will not happen. What happened is blood will go direct into the left atrium, right? So how is it done? So I use purple now. So blood from the right atrium, there is a hole there, a gap, right, between these two atrium, where blood from the right atrium drain directly into the left atrium with the help of this door. So what is this door? Okay, that door is the second shunt called foramen ovale. Alright, foramen ovale. So let me zoom in that part. Okay, I zoom in this part, right? So I have this, then I have this door. So I have this door. And this is right atrium, and this is left atrium. Like I say, pressure in the right atrium is higher compared to the left atrium. So what happened? The force from this side, the force from this right atrium, because the pressure is high, the blood tend to push this tiny door backward. All right, so it keeps opening. Okay, it keeps this blood try to push back this tiny door, so there will be a gap there between this tiny door and the wall. So what is their name? They have name. It's like opening your door. Okay, when you open a door, then you have a gap, right? So you can go out. So it's similar like this, right? So this tiny door is called primum, and this wall where this one should attach to is called secundum, right? So because the pressure is high in right atrium, so it push primum backward and cause a gap between the secundum and primum that allows the blood to pass through, right, and move into the left atrium. So when the blood reaches the left atrium, like normal, it will be pumped into the left ventricle, and from the left ventricle will pump the blood into the aorta, and what happened? It will supply oxygen, nutrients into all parts of the body, the head from top to bottom, right? So it will go down. All right, so only I say only most of the blood, right? Most of the blood will go from right atrium to left atrium. But what happened to the blood that cannot be drained into the left atrium? It's okay. They will go into the right ventricle. There is still a way for them, right? So like normal adult circulation, blood from right atrium go to right ventricle, then pumped out to the lungs via the pulmonary artery. So blood will try to go to the left and also the right lungs. Again, I said the lungs are not functioning. Okay, the lungs are not functioning. So let's focus on the lungs first. Lungs are not functioning. They are compressed. Alveoli are filled with fluid. So I draw alveoli here. Here. So it is filled with amniotic fluid. If it is filled with amniotic fluid, it is very impossible for oxygen to be there, right? And this is at fetal stage, right? So there is no oxygen. When there is no oxygen, what happens is the environment of the lung become hypoxic. Hypoxic means environment with less oxygen, all right? So okay, this is a bit wide. So because there is no oxygen, that causes the pulmonary capillaries that attach to the alveoli to constrict. What does constrict mean? It becomes narrow. The lumen becomes smaller, all right? When the lumen becomes smaller, for instance, I open the door with a small gap only. Can I pass through that gap? No, all right? So I need to open the door wide enough for me to go out. But here it is very small that even blood cannot pass through. But only a little blood, okay, little blood can pass through. So for instance, blood from the right atrium, right, this right atrium, try to go to the lung via the pulmonary artery. So this is pulmonary artery. So blood from the right ventricle try to go into the pulmonary and into the capillaries. But some of it cannot pass through because the pressure, again, the pressure is too high here, too high that it can cause traffic jam there. So the blood will not go into the lungs. So the blood which tries to move into the lungs, because of the high pressure, it kind of move backward, okay? Move like U-turn, okay? It U-turns into the aorta. Alright, so and that is your third shunt. Since the blood cannot go into the lungs, so they move backward, and through this third shunt, they move or drain into the aorta. So what is the third shunt? It is called ductus arteriosus, right? So ductus arteriosus because it's a duct between the two arteries, aorta and also pulmonary artery. And again, the pressure, like here, pressure in right atrium is higher than the left atrium, so blood tend to move from high to low. Same here, pulmonary artery, the pressure is very, very high along this vessels. So the blood tend to move from the high pressure into the low pressure. Aorta has lower pressure compared to the pulmonary artery. So the presence of ductus arteriosus helps to drain blood from the right ventricle into the aorta, and eventually all the blood will move into the aorta and supply oxygen nutrients to the whole parts of the body. All right, but as it goes down, oxygen become depleted because everything has been used up. So then you have deoxygenated blood or blood filled with waste products like carbon dioxide, urea, creatinine, right? They will be carried by umbilical arteries, which rise from internal common iliac artery. Right? So you have two umbilical arteries. So this deoxygenated blood will go back to the placenta and then drain into the placenta. Then the mother's blood, okay, the mother circulation will absorb all of this waste product, urea, creatinine, carbon dioxide, into her circulation and help to excrete for the fetus. All right, so that is what happened, right? When I say most blood, it means more than 90%, like 95 to 98%, or even 99%, will move from pulmonary artery to the aorta. For the 1% blood which makes its way into the lungs will go back into the left atrium, then to left ventricle, and same, it will drain into the aorta. All right. So that is the fetal circulation. Again, in summary, we repeat, right? So oxygenated blood from the placenta will be carried by umbilical vein. And then along the way, this umbilical vein start to split into two. You have ductus venosus, right? Ductus venosus, and also a pathway going to the liver. So this ductus venosus bypass this liver because it's a faster route to drain oxygenated blood into the right atrium. So eventually all the blood will still go into the inferior vena cava because they join the inferior vena cava and drain oxygenated blood into right atrium. Deoxygenated blood from the superior vena cava also drain into the right atrium, so there will be a mix of blood here. So that blood will move from right atrium to left atrium because pressure here is higher compared to the left atrium. And also the presence of hole there, the second shunt, which is called foramen ovale, that allows the blood to move from right atrium into the left atrium. Then normal circulation, left atrium to the left ventricle, then pump to all parts of the body via the aorta. So the blood that makes its way into the right ventricle will be pumped out into the pulmonary artery, but they cannot go to the lungs because the pressure is high, because of no oxygen, vasoconstriction. So this blood tends to U-turn and go into the aorta through the third shunt, ductus arteriosus, right? And then perfuse, and then the oxygenated blood will accumulate. So this will be taken by umbilical arteries and drain into the placenta, where the mother's circulation or the mother's blood will absorb it and excrete for them. All right, so that is what happened in fetal circulation. All right, so this is normal in fetal stage, at fetal stage. But what happened after birth, right? After birth, these three shunts must be closed, and there should be, and the adult circulation should be activated. All right, so how does it happen? So remember that when a baby is delivered, within 10 seconds, the baby starts to cry. So that cry actually triggers the baby's lungs to expand, to open up. All right, and their fluid inside the nose, okay, and the fluid inside the nose, their mouth got sucked out, and that create a way for oxygen to go in. All right, when they go in, when the air goes in, so I have alveoli here where the fluid got sucked out, and then I have this one, oxygen going in, right? So you have lots of oxygen now. Babies start to breathe, they cry they cry so hard that their lungs become, their lungs expand and allow air to go in. So that actually helps in dilating the capillaries, right? Because of the presence of oxygen, this pulmonary capillary starts to open. All right, because they can sense the presence of oxygen, so that triggers these pulmonary capillaries to dilate. All right, so what happens when it dilates is the blood from the right ventricle now doesn't have to U-turn. All right, doesn't have to U-turn. Why? Because this is now not congested. It is open now. The capillaries open its door for the blood from the right ventricle. So then all the blood from the right ventricles will start to rush in. Okay, will start to rush in into the left lungs, into the right lungs, right, via the pulmonary artery, right, right and left pulmonary artery, right. So imagine this side is the pulmonary artery, okay, receive blood from the right ventricle and into the pulmonary capillaries here. So they goes here. So in here there will be gaseous exchange because there is oxygen already, high amount of oxygen going into the alveoli. So there will be gaseous exchange. Carbon dioxide go there, oxygen goes here. So what happened? Blood become oxygenated. Alright, so this oxygenated blood will return to the heart via the pulmonary vein. Alright, so the pulmonary vein that can be found on the left and also the right will go back into the heart, into the left atrium. So now there will be lots of blood, oxygenated blood going into the left atrium. Alright, so what happened is the pressure now in the left atrium become higher than the right atrium. So right atrium actually gets lowered because later I will say that the umbilical cord got clipped, so that reduced the blood flow into this pathway, therefore reducing the pressure on the right side. So now left side the pressure is more higher. So what happened is, alright, so the first part is the expansion of lung. The second part is the foramen ovale will close, right? So how will it close? So previously, because right side has higher pressure, so it pushed this tiny door backward. It pushed this primum backward so that there will be gap to allow the blood from the right atrium into the left atrium. But since now it changed, right after birth it changed because lots of blood going to the lungs and then back to the left atrium, that caused it to have higher pressure. So the blood inside the left atrium will push back, all right, will push this tiny door or primum back towards the secundum. So because the movement of blood change or the pressure also change, now the blood from the left atrium, okay, left atrium receive blood from the lungs, right? That blood will push this primum onto the secundum, right? So now there will be no holes, and cause the primum to attach onto the secundum. So what happened is, because of the force, the primum will attach to the secundum and eventually join. Right? Both secundum and primum will attach and prevent any holes from showing there. All right? So that is the reason how the foramen ovale got closed. It's because left atrium now the pressure is high, so the blood that drains into the left atriums from both lungs will push the primum onto the secundum and close it. Alright, so this takes around 6 months to a year to close, and when it is closed, when foramen ovale closed, it has a new name, and the name is fossa ovalis. Right, the name is fossa ovalis when it is closed. When it is not closed, let's say after birth there's still hole there and it is not closed until adulthood, usually there is no significant symptom, although there will be a mixture of blood there. That depends on the size of the hole, but the patient will be under monitoring in case the hole or this hole will create problems to the person. All right, but usually it doesn't give any significant symptom, and if it does, it can be treated surgically. So there will be the hole will be plugged, or under cardiac catheterization, where catheter from the groin will go to your right atrium, then to the hole where it will plug the foramen ovale. All right. So if your foramen ovale open after birth, that is called patent foramen ovale, and that is type of atrial septal defect. All right. But when it is closed, it is called fossa ovalis. Right. So nice. Then the blood from the left atrium pumps downward into the left ventricle. So left ventricle then pump blood into the aorta, and then this blood will be going to the upper parts of the body, then go downward and perfuse the organs, the cells, right? So the baby can grow healthily, right? So now the movement of oxygenated blood actually trigger this third shunt, ductus arteriosus, to close. What triggers them to close is, ductus arteriosus, the wall of ductus arteriosus can sense the oxygen level inside the blood. So during the fetal stage, the oxygen is not that high, the concentration is not that high. But after birth, because of the oxygen going into the alveoli, and then blood got oxygenated, then pulmonary vein brings the oxygenated blood back to the left atrium, then to the left ventricle, then out to the aorta. So around here, the ductus arteriosus, the wall, sense the high concentration of oxygen. So immediately it will start to close itself. And this duct, this ductus arteriosus need to be closed by itself within 3 days. Because if it doesn't close, problems will happen. Why? There will be a mixture of blood there. Okay, so like I said, pulmonary artery, now the pressure is lower because this capillary starts to open, so pulmonary pressure starts to go down, to reduce, and blood starts to go to the lungs. And in turn, aorta has higher pressure because it has to pump blood to all parts of the body. So now exchange of pressure gradient. So if it remains open, oxygenated blood in the aorta with high pressure will be pushed downward into the pulmonary artery. Then it goes to the lung and cause stress onto the lung because the lung is overloaded with blood, right? And also, if the oxygenated blood in the aorta will go into the pulmonary artery, there will be less oxygenated blood going to all parts of the baby's body, to the organs. So that can create organ failure, all right, because not enough oxygen and nutrients going to them, right? So that is the reason why ductus arteriosus needs to be closed within that 3 days. In premature babies or in babies with respiratory distress syndrome, they have difficulty in the closure of the ductus arteriosus. So usually premature babies are given intravenous ibuprofen. Why ibuprofen? Because ductus arteriosus also produces a chemical called prostaglandin, and that prostaglandin, its function is to let the ductus arteriosus stays open. So ibuprofen will inhibit that prostaglandin from becoming active, so allowing the ductus arteriosus to close, right? So if it remains open, it is called patent ductus arteriosus, and it really creates problem. Like I mentioned earlier, it will overload the lungs, right? And less perfusion to the body, the baby's organ. But when it is closed, within 3 days it should be closed. Its name is ligamentum arterioseptal. venosus. All right, so ductus arteriosus also wants to change its name. Okay, never mind. So that one closed. Okay, here first, oxygen goes in, oxygenated blood, gaseous exchange, oxygenated blood go to the left atrium, pressure high there, cause the foramen ovale to close because the primum got pushed towards the secundum, so it will close within 6 months to a year. Then the oxygenated blood, highly oxygenated blood, will be pushed to the left ventricle. Then left ventricle pump the oxygenated blood to all parts of the body. Alright, and because of the highly oxygenated blood, ductus arteriosus here sends the high level of oxygen, so it triggers the ductus arteriosus to close. Alright, and it must be done within the 3 days after birth. So that is fine. So 1, 2, and 3. So now left with ductus venosus. So how does ductus venosus here, okay, how does ductus venosus here close? All right, so just now there is blood flowing here, right? So after birth, usually the umbilical cord got cut, right? It got cut or clipped and then cut, right? So that triggers the ductus venosus to close. Why? Because there is no blood flowing into this pathway anymore. So that triggers the ductus venosus to close. So slowly it will close itself, and this usually happens within weeks to months, right? So it will close by itself. And again, ductus venosus also wants a new name when it is closed. What is the name? Same like ductus arteriosus. Ductus will become ligamentum. Ligamentum. It's a ligament actually. Ligamentum venosum. Ligamentum venosum, right? So again, this one closed, so everything is fine now. So the circulation also will become like how adult circulation happens. So that is what happened to the newborn baby also. All right, no more fetal circulation. Fetal circulation only happened during the fetal stage there, right? But now the adult circulation starts to become activated. So that is all about fetal circulation. Again, I want to summarize everything again. So oxygenated blood in the placenta will be carried by the umbilical vein into the heart by a 2 pathway, but the common one is the ductus venosus because it bypasses the liver, so oxygenated blood will drain into the heart quite more faster than the blood which goes to the liver sinusoid, but most of the blood will follow this pathway, right, the ductus venosus. So it drains blood into the right atrium together with the deoxygenated blood from the superior vena cava, and the pressure is high in this right atrium because lots of blood drain into this right atrium that cause pressure difference between right atrium and left atrium. So that caused the blood inside the right atrium, most of the blood in the right atrium, to move towards the left atrium, high to low. So blood from high pressure will move to the low pressure, and that caused the pushback of the primum. So primum got pushed back, create a hole, and that allows the blood to move into the left atrium. So from there, it moves to the left ventricle and pumped out through all parts of the fetus body, through fetal organ for the development by distributing oxygen and nutrients. So the blood that make its way to the right ventricle will be pumped to the pulmonary artery, but not going to the lungs because the pressure was high here. So it goes in reverse or U-turn and goes into the aorta. Why? Because the pulmonary, the pressure is higher than the aorta because of the vasoconstriction here. So it goes into the aorta. Now all the blood goes to the all parts of the fetal's body. All right. So that is what happened inside the fetus. So you have ductus venosus, foramen ovale, and also ductus arteriosus, which are very important in fetal circulation. But right after birth, once the baby cry, lung expand, the liquid got sucked out, so that allow oxygen to get into the lungs, into the alveoli. So lots of oxygen cause the pulmonary capillaries to expand, to dilate. So when it dilates, it reduces the pulmonary pressure. Why? Because now all blood from the right ventricle will go into the pulmonary artery and into the lung. They will not go in through this shunt anymore. Because the door is open now. Lung is welcoming all the blood from the right ventricle. So all the blood will go to the lungs, right? To the lungs via pulmonary artery. Then inside the lungs there will be gaseous exchange, so oxygenation happen. So now all the oxygenated blood from both lungs will be drained into the left atrium. All right. So now reversal. All right. Left atrium now has higher pressure compared to the right atrium. So the blood in the left atrium, because the pressure is high, it push this primum towards the secundum. All right. Now secundum and primum attach, so there will be no hole present. Eventually, within 6 months to a year, this foramen ovale will be closed. There will be no gap there. And when it is closed, it is called fossa ovalis. All right. So now the highly oxygenated blood from the left atrium go to the left ventricle, then pump to all parts of the body via the aorta, and highly oxygenated blood got sensed by the ductus venosus, okay, from the ductus venosus, and this ductus venosus sense the high oxygen concentration and cause it to close, right? So it must be closed within 3 days after birth, must. If not, the blood from the aorta will enter the pulmonary artery and overload the lungs and cause more problem, right? So then the closure of ductus arteriosus separates, closure of ductus arteriosus and foramen ovale actually allow the separation of oxygenated blood and deoxygenated blood. So there will be no mixture of blood now, right? Because the baby need to grow, so they need highly oxygenated blood, okay, to be supplied to all the cells and the organs. All right. Okay. So how about the ductus venosus? Once the baby is delivered, the umbilical cord got clipped and then cut, so there will be no more blood flowing into this ductus venosus. So eventually it closes, right? And when it closes, it becomes ligamentum venosum. So less blood going to the right side of the heart causes the pressure inside the right side to become lower than the left side. All right. So that is what happened in fetal circulation and also after birth. Just remember the shunts and what happened in the lungs that causes the reversal of circulation in the fetals during the fetal stage, right? And what happened after birth, once the baby cry, then the lung expand, then the adult circulation got activated, right? So that's it for the fetal circulation. I hope you can understand this, because I tried to explain it in a simple manner, not too detailed. If you want more info or detail, there are lots of journal articles in the internet that you can find, and it's all free. And also if you have medical book, also it's good. All right. So I got all the info also from the medical books here, and also info from the internet. Okay, the journal. Just take the reliable info. Okay, the trustable. Okay. Thank you for watching, and bye-bye.